This is Radio Health Journal. I'm Reed Pence. This week, solving the low survival rate of pancreatic cancer.
Typically, by the time the tumor is seen on a CT scan, it's still late. By the time you see a 2-centimeter tumor, it's nearly 7 to 10 years old, and even some research has shown that it could be all the way to 15 years old.
One of the deadliest of all cancers, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Throw away that old script and trust ourselves to improvise and relate in that moment. We'll get a much better result.
Flipping the script by practicing improv. Then
they would show this wall of categories, and you would choose your category, and the host would push a button, and an IBM sorting machine would start spitting out question cards.
We explore the game shows of the past. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Our attention this year has been consumed by COVID-19, with good reason, but it's taken our focus away from other causes of illness and death that are also increasing and need our attention to treat and cure. Pancreatic cancer is one you'll be hearing about later on this week, with the annual list of notable people we've lost in the last year, a list that includes pancreatic cancer victims like Supreme Court Justice Ruth Bader Ginsburg and civil rights icon Congressman John Lewis. Then next week, the Last Jeopardy programs taped by Alex Trebek before his death in November will be airing. Trebek had been open about his health since his announcement in March of 2019.
Just like 50,000 other people in the United States each year, this week I was diagnosed with stage 4 pancreatic cancer. Now, normally the prognosis for this is not very encouraging, but I'm going to fight this, and I'm going to keep working, and with the love and support of my family and friends, and with the help of your prayers also, I plan to beat the low survival rate statistics for this disease.
I think he was a highly intelligent, very balanced, realistic person. And as he said, he knew the odds were low, but he was determined to do it. And I think that's the right attitude. He obviously had a lot to live for and wanted to press on with everything that he had in his life. And he didn't want the disease and the fight against it to dominate all his other things that he wanted to accomplish and live for.
That's medical oncologist Dr. Richard Frank, director of cancer research at Nuvance Health Cancer Institute. He was impressed by Trebek's openness.
I was rooting for him, and you never know. You never know the details of someone's cancer. If a person does have a genetic predisposition to pancreatic cancer, then actually treatment is much improved. And there is one targeted therapy for pancreatic cancer that was recently approved. It's a drug called olaparib, and it targets the gene that's defective in individuals who have a BRCA genetic mutation. So I didn't know. Maybe he had that. Maybe there was something favorable about his cancer. You never know the specific details. And even if he didn't have anything specific, I definitely have patients who are 2 years or longer out with stage 4 disease, just receiving routine chemotherapy. So it is possible.
Possible, but not likely. Deaths from pancreatic cancer are increasing, and Frank says soon it'll become the second leading cause of cancer death in America, behind only lung cancer.
The average survival for all stages of pancreatic cancer is between 1 and 2 years, but only 10% of all affected people survive 5 years or are technically cured. Approximately 20% of those diagnosed with advanced stage 4 pancreatic cancer have a very limited survival inside of 3 months. It's not advertised. It's not talked about, and often. So it's a range. So even though you're talking about stage 4 pancreatic cancer, you've got individuals who are not going to make more than a few months, and then you've got other individuals who may live a few years. So there is a broad range in the way the disease manifests and the biology of the individual whom it's affecting.
Those kind of odds mean that pancreatic cancer still retains the reputation all cancers once had as likely killers. So does that make it a tough diagnosis to deliver?
You always have to temper or qualify bad news with good news. The fact that there is a terminal or incurable malignancy doesn't mean that there's not hope for improved symptoms, longevity, a reasonable quality of life, and when it does come, a dignified, painless death. That is certainly something very important. So there's always things to hope for.
There are also things to hope for in treatment. Frank is among researchers working on ways to get around the major reason the prognosis is so often poor.
It is detected at a later stage when surgery or cure is not possible. And at the later stages, the therapies have not advanced into the modern era in the sense that chemotherapies have improved, but pancreatic cancer has not benefited from the revolutions in genetics and immunotherapies that have benefited so many other cancers, and that just relates to the difficult biology of pancreatic cancer.
Pancreatic cancer typically doesn't have any symptoms till it is late. And even if a CT scan is used to pick up a tumor in the pancreas, typically by the time the tumor is seen on a CT scan, it's still late.
That's Dr. Somsekhar Krishna, Associate Professor of Gastroenterology at the Ohio State University Wexner Medical Center.
In case we see a tumor which is about 2 centimeters in size in the pancreas, research has shown that by the time you see a 2 centimeter tumor, it's nearly 7 to 10 years old, and even some research has shown that it could be all the way to 15 years old. Using other investigations like MRI or endoscopic ultrasound can potentially detect these lesions at a smaller size, say 1 centimeter. But even then, sometimes it's too late because unlike most other cancers, pancreatic cancer tends to metastasize early on at smaller sizes, meaning that where it could have spread to other parts of the body.
Krishna's work involves pancreatic cysts, liquid-filled growths that may turn into cancer, but don't always. He says cysts are common in the pancreas.
Studies have shown that up to 5 to 10% of CT scans done for some other reason picks up a cyst in the pancreas, and then up to 30 to 40% of MRIs of the abdomen can also pick up cysts in the pancreas.
But how do you determine which cysts will turn into cancer and which ones won't? Krishna's using a new video technique.
We pass a flexible endoscopy tube into the stomach, and the tip of the scope has an ultrasound probe, and we turn the ultrasound on to see the pancreas, which is right behind the stomach, and we can scan the pancreas, and once we see a lesion, be it solid or cystic, we can take a sample of that lesion using a needle which is passed through the endoscopic ultrasound scope. Now, once the needle is in the lesion, we can pass a much thinner camera or a laser endomicroscopy probe into the lesion and get a live video feed, thereby diagnosing what kind of a cyst this is, whether this has a potential to turn cancerous or this is a completely benign, innocent, harmless cyst.
In early tests, Krishna says the video diagnosis is 95% accurate, compared to only 65 to 70% for current biopsy methods. Misdiagnosis can lead to either missing real cancers or to surgery when it's not needed.
Pancreatic surgery is not a simple deal. It's got a lot of complications, including diabetes and malabsorption because of decreased enzymes to digest the food. And the risk of these long-term complications after pancreatic surgery are anywhere from 20 to 30%. Overall, pancreatic surgery is a hard surgery for the patient, given its risks.
However, few people have CT scans or MRIs for other reasons that end up revealing early pancreatic cancer, and there are few risk factors that might lead people to have such a scan before any symptoms.
It's not the link like smoking and lung cancer. It doesn't really exist for pancreatic cancer. About 20% of individuals do have some family history of it, interesting. So there is a genetic element, but only 7% have an identifiable gene, like BRCA, BRCA1 and 2, which are more commonly associated with breast and ovarian cancers, these genes also increase the risk of pancreatic cancer in families who have them.
And as we've heard, there are few real symptoms early on.
You can have jaundice, and that can be the first sign, and you could have a small curable cancer. If the tumor occurs at the head of the pancreas, at the area there where the bile duct comes in, there's a growth and it immediately causes jaundice, you can still be cured. But as you're saying, most people, when it's not at that right point, at that right spot in the body, they may complain of vague abdominal pains over the course of 6 months or a year. The doctor thinks of the usual suspects. Maybe they'll get an upper endoscopy or a colonoscopy, and it takes a while before they finally get a CAT scan, because most abdominal pain is not pancreatic cancer, and we don't have a blood test for pancreatic cancer.
Frank's work is seeking to find such a blood test. They're doing MRIs and drawing blood from a select group of people who show up with perhaps the most significant early sign of pancreatic cancer, a sign that most people should know.
There's one sign of pancreatic cancer potentially in an individual over 50 who's losing weight, especially if they have new onset diabetes. And that is the study that we're running. Individuals who are over 50 who have new onset diabetes, they may have an underlying pancreatic cancer, and they're in a higher risk group. It tends to be those who have the greatest change in their sugar. So no, we're not talking about somebody who becomes pre-diabetic and then gradually becomes diabetic, but someone who may have a normal glucose of 80 routinely, and then all of a sudden it pops to 200 as they've developed diabetes and they've lost some weight. So again, that's different than the average person with type 2 diabetes. They often gain weight, which the weight gain is part of the reason they've developed diabetes. In pancreatic cancer, it's the opposite.
Finding a blood marker in that population is difficult. The number of those affected could be only around 1%. But with blood tests every year and correlating blood markers in those whose MRIs show they're developing pancreatic cancer, Frank and other groups working in the same area hope to solve the diagnostic riddle for a cancer that's evaded detection so far. You can find out more about all of our guests through links on our website, radiohealthjournal.org. I'm Reed Pence.
Supporting immune function through a healthy diet has become an important new focus for many people these days. One key recommendation is to eat more vegetables and fruits, such as grapes, every day to improve immune function. Combining grapes with vegetables can help achieve this goal in a tasty way, according to registered dietitian Courtney Romano, health advisor for the California Table Grape Commission.
Fresh grapes are heart-healthy and hydrating and linked to benefits in multiple areas of health, including supporting immune function. Grapes are always a smart snack choice on their own, and they also pair well with other healthy foods such as vegetables to enhance flavor and nutrition. Add grapes to a kale, spinach, or arugula salad. Roast grapes with cauliflower or broccoli. Combine grapes with cucumbers and feta for delicious and healthful eating.
Grapes from California are a natural source of antioxidants and other polyphenols. Visit grapesfromcalifornia.com for more information and over 300 recipes.
A good night's sleep means everything no matter where you are. Luckily, there's a CPAP machine for home and away. The Philips DreamStation Go offers the best of both worlds, a lightweight and discreet travel CPAP designed for everyday use that can be carried wherever you go. Dr. Mark Aloya is Global Lead for Behavior Change at Philips Healthcare.
Most people don't realize that missing just one night of CPAP therapy, which happens often when we travel for business or for pleasure, can put you right back to square one. Now there are more options than ever for CPAP therapy with the recent introduction of travel-sized CPAP devices like the Philips DreamStation Go.
Whether you're at home sleeping soundly or chasing a new adventure on the road, the Philips DreamStation Go is the everyday travel CPAP you want by your bedside. Find out more at philips.com/DreamStationGo. That's PHILIPS.com/DreamStationGo.
With attention focused on COVID-19 during the past year, it's easy to miss important developments in other major diseases. For example, during 2020, the drug pipeline for Alzheimer's disease heated up with 2 new drugs under review by the FDA, one that may slow the disease and another that treats symptoms of hallucinations and delusions. Over 300 other therapies are in clinical trials. Also in 2020, breakthrough research presented at the Alzheimer's Association International Conference brought us closer to a blood test for Alzheimer's. Such a test, once validated, would be an accurate, inexpensive, and accessible way to diagnose Alzheimer's. This would enable early intervention when new drugs become available. Other studies from the Alzheimer's Association International Conference suggest that getting vaccinated against flu and pneumonia after age 60 may have an unexpected additional benefit, reducing risk of Alzheimer's. Find out more about Alzheimer's research in 2020 at alz.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
We've done incredible, and there's huge support in the population across the world for these things. But that said, we've still failed.
How better messaging could get more people to wear masks and socially distance.
Then how childhood emotional trauma leads to poor health decades later.
The way in which the genes that oversee our proper stress response do not function properly for life.
All that and more on Radio Health Journal.